And then there's a question here about where would you fall if you're an adult, but I'm going to say an adult or a child, immune suppressed, but also have other underlying issues like respiratory problems. So for example, Eric, maybe I'll just change a little bit for you. If there was a child who had type 1 diabetes and also inflammatory bowel disease and they were on a drug like a biologic, how does that change your risk paradigm?
Well, I mean, I think with type 1 diabetes, it might not be the best of examples because it depends on what their control of their diabetes is, right? Just as with IBD, if your diabetes is well controlled and your hemoglobin A1C is great, I'm less worried than if your diabetes is out of control and you're at risk of going into ketoacidosis or something. But I think an even better example might be asthma, severe asthma, or other lung diseases like cystic fibrosis. I'd be worried, right? And I think that as the pediatric gastroenterologist, I would be working with the respirologist or the endocrinologist or the other specialists that are involved in the care of this child to start to develop, almost a custom personalized risk matrix to say, how risky is it for your child to go to school at this point? And I think the same goes for adults. I mean, you kind of implied this yourself, Gil, that although you're young and fairly healthy, you have this risk of asthma and you have this history of lung problems. And so while you've made a decision to go to work, it's perfectly acceptable that if somebody with a similar situation decides not to go to work. And I'd say that those people who have these multiple risk factors might want to discuss it with their physicians. And while, if the IBD is under control and they're not on steroids and they're feeling well, your gastroenterologist may say, well, you better speak to your respirologist and see what they say first. So we should all be working together to figure out what's safe and what's not for you as a patient, individual patient.
Yeah, and I think the answer that you gave was exactly the same that I would say for adults, whether it be diabetes, it comes down to, are you well controlled or are you out of control? Similarly, there are fixed conditions and there are variable conditions. So asthma is a variable condition. We can get that under control working as a team with your respirologist so that you could be well, feeling well, and your risk being low. If you have chronic obstructive pulmonary disease, COPD, that's a fixed defect. That's something that we can't get the lungs better. And we know that if you were to expose to a virus, whether it be influenza or COVID, your risk is much higher. And that's where creating that personal risk with your physician helps you kind of navigate those decisions for you.